So what is autism spectrum disorder? What is autism? Someone has to say something. What is autism? Or I will pick up the last benches most preferably. So last benches. What is autism? Say anything. Have you heard the term autism? No. Very good. What is autos? Autos in Greek means self. So there are some spectrum of disorders which falls under the problems which have the same characteristics. That means the children are absorbed to themselves or the patients are absorbed to themselves. What is spectrum? Last but one, colorful shirt. What is spectrum? Range. Okay. So what is that range? So we call any range a spectrum? No. So when we will call autism spectrum disorders. So what are the characteristics for a disorder to fall under spectrum? So type, severity and okay, very good. At least you tried. So what is spectrum? So these are the group of disorders that have similar etiology. So the pathogenesis will be the same, the causative agent will be same, or the genetic factors or immunological factors, whatever we say. So they may be having the same etiology. Or phenomenology. What is phenomenology? What is phenomenology? You know anything? So he can say, what is phenomenology? So what is autos? A-U-T-O-S. Just now I told you. In Greek, autos means self. Okay. It will be a 19 lectures class. The last slide will be thank you. So most probably you will be having 17 slides. It will take around 25 minutes, 25 to 30 minutes. So if you have any urgent work, you can just leave. Otherwise, you can stay here. But I will give the absentees list to the principal, sir. So phenomenology is something which a disorder will be having. In psychiatry, phenomenology plays a significant role. For example, delusions, hallucinations, and disorganization, these comes under phenomenology. So a group of disorder which can have the same etiology or it can have same phenomenology or prognosis, either it is a good prognosis or poor or guarded prognosis, and treatment modalities. So the disorders that falls under this spectrum will have the similar treatment, either it can be pharmacological basis or non-pharmacological basis. So we will see what is the history of autistic disorders. In the last class, there were only 4 students. So there was one slide I told them who coined the term schizophrenia. So this is the person, that is Eugen Bleuler, who coined the term schizophrenia. And he also gave 4 A's. Can anyone tell me what are the 4 A's of schizophrenia? Four A's. Eugen Bleuler has given 4 A's of schizophrenia. So one of the A is autism. Autism, ambivalence, affective disturbance and association disturbance. These are the 4 A's that were given by Eugen Bleuler. Yes please, who has given the term autism? So just listen. The word autism is used by Eugen Bleuler initially as a part of schizophrenia. So he gave this term to a certain limited population of schizophrenia, thinking that these people are distinctive from other psychotic patients. That's why he has given the term autism. Then American child psychiatrist Leo Kanner, MD, he first published a paper Of the children, he took 11 sample who were highly intelligent but displayed a powerful desire of aloneness. Powerful desire of aloneness. He later names their condition as early infantile autism. So, early infantile autism is given by Leon Kanner. Then a German scientist, Hans Asperger, described a milder form of autism known as Asperger syndrome. And Bruno, he gave the term refrigerator mother. So, one of the psychosocial theories also says, like the mothers who are not taking care of their children may give the children autistic symptoms. So, this Bruno popularized the term refrigerator mother, meaning autism caused by not loving their children enough. So, infantile autism is listed in DSM for the first time. So, what is DSM? What is DSM? Have you watched that movie Rain Man? So, it was one of the first movies on autism, mainly to improve public awareness. Light It Up Blue was one of the campaigns has been organized by United Nations in order to increase the awareness on autism, and the DSM-5 folds all subcategories of the condition into one umbrella diagnosis of autism spectrum disorder. So, nowadays we are using DSM-5 and ICD-11. So, ICD is being International Classification of Diseases and DSM being Diagnostic and Statistical Manual. So, currently we are having two versions, DSM-5 and ICD-11. Both of them, they have the diagnosis of autism spectrum disorders. So, what is this symbol? But AIDS is something different. There are puzzles, there are rainbow colors. So, this sign has been adopted in 1999 as the universal sign of autism awareness. The puzzle pattern reflects the complexity of the autism spectrum. So, there are multiple puzzles in this picture. So, it reflects the complexity of the autism spectrum, and the different colors and shapes represents the diversity of the people and families living with this condition. So, there are colors, there are different patterns which indicates different identities. So, this is how the evaluation of autism terminology and symbols. So, initially there were puzzle pieces which shows the complexity of the disorder. Then there was infinity symbol which shows that there is much more in this disorder what we normally see. And then there is a term called neurodiversity. Then today we are using butterflies and blue lights which shows that autism is not a disability, but we can say that they are disabled or differently abled children. So, we use two classifications, as I mentioned, ICD and DSM. So, initially in ICD-10 we were using pervasive developmental disorders, where autistic spectrum disorders have been included under this. So, it includes childhood autism, atypical autism, Rett's, other childhood disintegrative disorders, Asperger's, PDD. In ICD-11, now they have started using the term autism spectrum disorders. There are two subcategories or two subdomains in which you will be having with intellectual impairment or without intellectual, and with language impairment or without language impairment. So, these are the two subcategories that have been given under ICD-11. So, initially in ICD-10 they used pervasive developmental disorders. In ICD-11 we started using autism spectrum disorders. Again in the same way, DSM-4 and DSM-5. In DSM-4 we used pervasive developmental disorders, whereas in DSM-5 it is autistic spectrum disorders. There are three core components in DSM-4, whereas that has been reduced to two core components in DSM-5. So, the three core components in DSM-4 includes social impairment, language difficulties, and RRSBIA. What is RRSBIA? So, it is written here only in the slides. What is RRSBIA? Please, someone is saying. What is RRSBIA? So it is not completely shown. So restricted, repetitive, stereotypes, behavior, interests and activities. So this is one of the domain in which the symptoms of autism spectrum disorders were included. So according to DSM-5, there are three categories, three core domains: social impairment, speech or communication deficit and language delay, and restricted repetitive behavior, interests and activities. Whereas DSM-5, they have clubbed both social impairment and language under one domain, that is social and communication. Whereas the restricted repetitive behavior, activities and interests are still, it has been included under the separate domain. So what is the epidemiology? Autism spectrum disorders or ASD is typically evident during the second year of life. So most of the times we will, if we see any 2-year-old child, you can easily diagnose autism spectrum disorder. But more often we will diagnose the children by 3 years, but it will be mostly evident by second year of life. In milder cases, the disease is identified at a later stage due to the difficulty of the symptoms, identification of symptoms. And of course, it is more common in males when compared to females. So what is caused by, so how ASD is caused? What are the causative agents or what are the reasons? So there is one controversial thing, that is vaccination. So we will see the immunological factors first. So the immunological incompatibility, if the maternal antibodies have been released against the fetus, maybe that could be one of the causative agent. I have specifically said maybe. It's not that is the main reason for autism spectrum disorders, but that could lead as a risk factor for autism spectrum disorders. And there was once a controversial thing, that is MMR vaccination. So they found that the children who were taking MMR vaccinations, the ASD prevalence is significantly high. But that is still controversial and there is no significant evidence which suggests towards the causative and relation between MMR vaccine and ASD. Genetic factors. First degree relatives are almost 20 to 80% or 80-fold more likely to be affected and most commonly associated with Fragile X. So what is Fragile X? So what is the problem in Fragile X? It is not written there. Any other syndromes you know in pediatrics? One I have mentioned, Fragile X. Any other syndromes you know? Rats, then? So macro-orchidism is a typical feature in which syndrome? Macro-orchidism. Yeah, Fragile X. Okay. So in Fragile X, almost 30 to 50% of the children, they are going to have this autism spectrum disorders. And they are also most prone for shyness, anxiety, following which they will be having cluttered speech, tangential speech. So any other syndromes you know? Pediatrics, because this topic is related to child and adolescent, so we have some syndromes also. Pandas. What is pandas? So where does this topic pandas comes? So in psychiatry, how it is related? Pandas is related to which disorder in psychiatry? Anyone? No, it is related with OCD. Pandas is related with OCD. Any other syndromes? Down syndrome, Turner's, Klinefelter. What is Downs? So what happens in Downs? Trisomy 21. Then another reason? What one is trisomy? Which chromosome? 21. The other one? Translocation 21. Robertsonian translocation. And one person will be mosaic. So in Fragile X, what happens? In Fragile X, amplification of trinucleotide repeat, that is CGG. Okay. So where orchidism is a typical feature, following which the other speech disorders that I have mentioned. The Fragile X syndrome is one of the most common reasons for autism spectrum disorders. Then prenatal risk factors. There are few risk factors which can lead to autism, which includes advanced paternal and maternal age, maternal gestational bleeding, and gestational diabetes. Perinatal risk factors include birth trauma, fetal distress, low birth weight, and congenital malformations. Basically, the risk factors which led to the hypoxia of the child. So, any risk factor which causes hypoxia to the child, they act as risk factors for autism. Any neurodevelopmental disorders as per we say. So, what is the DSM-5 diagnostic criteria? What is DSM? Diagnostic and Statistical Manual. So, currently we are using 5th version. Normally what happens now in PG exams, NEET PG, INI set, you prepare a lot about the advanced things. You start preparing the most advanced topics in psychiatry, but normally what they ask is what is the classifications that are used in psychiatry. ICD, DSM, what is the current classification, what is the full form of ICD, what is the movie that is related with autism spectrum disorders, what is the sign for autism spectrum disorder. So these are the things that you will get. So that's why the basics are very important. So there are two core domains as I have mentioned. One is social and communication, the other core domain being restricted repetitive behavior, interests and activities. So if we see here the first one, that is social and communication, deficits in social emotional reciprocity, deficits in non-verbal communicative behavior used for social interaction, deficits in developing, maintaining and understanding relationships. So these three subdomains comes under social and communication, where the children are having deficits in both social relationships and language problems. Whereas the second one, that is restricted repetitive patterns of behavior, interests or activities, as manifested by at least two of the following. One is motor movements, that is stereotyped or repetitive motor movements. What is stereotypy? What is the difference between stereotypy and mannerism? What is stereotypy? So basically, if you know the difference between stereotypy and mannerism, you can easily answer this question. So which is having purpose and which is not having the purpose? Stereotypy is having purpose, the movements. So non-purposeful movements comes under stereotypy, whereas purposeful movements comes under mannerism. So that they are stereotyped or repetitive motor movements, use of objects or speech. So the children, they are using the motor movements which are not having any specific purpose. That's why we call them as stereotypies. Insistence on sameness, inflexible adherence to routines or ritualized patterns, highly restricted fixated interest, hyperreactivity to sensory input or unusual interest in sensory aspects of the environment. At least name one series which is having autism. The person is having autism. One Netflix series. Good Doctor. So every time he mentions autism spectrum rather than autism. Have you ever seen why they have called spectrum? And if you see all the signs and symptoms, it is almost related to him, like the way he acted and everything. So you can see all the signs and symptoms. So these symptoms must be present in the early developmental period. As I have mentioned, it should be at least by 2 years or mostly evident by 3 years of the age. And these symptoms should cause clinically significant impairment in social, occupational or other important areas of current functioning, are not better explained by intellectual disability. So this is one of the differential diagnoses of autism spectrum disorders, intellectual disability. So of course in autism spectrum disorders we have a special domain, that is with or without intellectual impairment, but you have to differentiate it whether it is completely an intellectual impairment or intellectual disability disorder or autism spectrum disorders with comorbid intellectual impairment. So again, specifications, with or without accompanying intellectual impairment, with or without accompanying language impairment, any medical or genetic or environmental conditions, neurodevelopmental disorders, or with catatonia. So what are the deficits in social communication and interaction? Before going that, tell me how a child, so a mother brought a child to you, her child to you at 2 years of age. What are the complaints the mother will tell you? So what are the complaints that mother is going to tell you? See, doctor, my child is having, these are the problems. How a mother presents to you with autism spectrum disorders, like how she brings her child. Any signs and symptoms disorder, that means the mother says, see doctor, my child is having speech delay, like he was not able to speak properly at his appropriate age. There are some few developmental delays that are present. Then social shyness, that, but how she presents to you. So how she explains to you that my child is having problem. How she presents. Hmm? Then, so a 2-year-old child, how he or she presents. Hmm? I have told you the signs and symptoms, like the class DSM-5 criteria. See, the first, when a child develops social smile, at what age? Hmm? So normally the book says 3 months. Okay, so the child may not develop a social smile. Whenever the parent looks to the child doesn't smile. So may not develop a social smile. Older babies may lack the anticipatory posture of being picked up by a caretaker. So whenever the mother goes to the child or whenever the father goes to the child doesn't give the anticipatory posture, like lift me up. So that posture is lacking. And less frequent and poor eye contact. The eye contact is very poor. The social development is characterized by atypical attachment behavior. So even though they are having the attachment, that attachment is very atypical. That is not what normal babies have. This may not differentiate the most important persons in their lives, parents, siblings. So for example, if we leave the child with a stranger, for example, if you leave the child with a stranger who is completely unknown to the child. So what normal expectation? What is normally expected from that child? He will start crying, he will start asking for his mother, or he will start asking for his parents. So that is lacking here. May not react strongly when left with a stranger compared to others, and often display extreme anxiety when their usual routine is disrupted. That is very important. Like they have that same restrictive behavior, like the same routine has to be followed, the same routine has to be done. So that is how their usual routine will be done. So if any of their usual routine is disrupted, the child started crying, the child starts to have these problems. So you want to see any videos we can display there? No. If you have any videos, we can. So what are RRSBIA? So there are certain stereotypies, there are certain patterns or behavior which are commonly seen in autism. From the first year of life, a child with autism, ASD, has developmentally expected exploratory play is restricted and muted. So normally the exploratory play, so whenever you give the child any toy, whenever you give the child any utensil or anything, so the child plays, or he will explore that utensil, or he will explore with that toy. That exploratory play will be very much restricted in these children. Then toys and objects are often manipulated in a ritualistic manner. Normally if you give the same toy to a normal child and an autism child, the pattern of playing is completely different from a normal child with an autism child. Do not show the level of imitative play, the imitation during playing, that is lacking. The activities and plays are more rigid, repetitive and monotonous than their peers. Even if the friends comes to the home and asks the child to share his or her toys. The child doesn't share and the child wants to be alone. Then some compulsive behavior such as lining up objects and may exhibit a strong attachment to a particular inanimate object. There is a strong attachment to some inanimate objects. That inanimate objects also will be mostly picked up by their roughness. The more rigid the objects, the more attachment to the child. So what is the course and prognosis? Last 4 slides. Last 4 slides. So what are the core domains of autism spectrum disorders? Please. So according to DSM-5, what are the core domains of autism spectrum disorder? So you want to diagnose an autism spectrum disorder. A mother brings you the child. You just please switch it off. We will. You can see it later. Okay, no issues. So a mother brings the child to you, saying that what is your name? Kajiruddin. Dr. Kajir, so please, my child is having this problem. So how can you diagnose my child as having autism spectrum disorders? So you will say that class I have missed. I have missed that class. Maybe I was not feeling well during that class. Common means that you encounter. Like you have to diagnose, otherwise the parents won't leave you. Maybe your own family members, they brings you saying that my child is behaving some weirdly. So does these symptoms are suggesting towards autism spectrum disorder? Every child who behaves weirdly doesn't mean that the child is having autism. Okay, so that's why you need to know some diagnostic criteria. Until and unless you don't know the diagnostic criteria, you can't diagnose autism. At least you have to say, acha, the psychiatrist that said as the child is having autism, maybe you have to collaboratively accept that as the child is having autism. Or otherwise you will say, that psychiatrist is very much senior. Now I am studying final year part 1 MBBS. How can I know? I don't know how to give injection. I don't know how to talk with the patient. So how can you ask the clinical features or diagnostic criteria of autism spectrum disorder, which is way more above my level, right? That won't be your answer. You would like to say, help your friend. No, there are 2 core domains under DSM-5. Social and communication, that is one domain. The other domain is restricted repetitive behavior, interest and activities. So the person is having, the child is having deficits with social and communication pattern. Also the interest, behavior, activities, they are restricted, repetitive and stereotype. Okay, so once you know that at least the core domains, then you can go for the individual each domain. You understood, right? So if I ask you what is DSM, you can say. Very good, systemic. So after a 30 minutes class, you are saying diagnostic and systemic. So tell me what is ICD? Very good, very good. ICD is intellectual. ICD. ICD. So so the question is wrong. I should have asked you what is IDD, right? So my question is wrong. So I should have asked you what is IDD. But it is not about IDD and autism. It is about DSM and ICD. What is ICD? International Classification of Diseases. Okay. So what is the course? Again, that same parent brings you the child with the similar complaints and you have diagnosed the case as autism. Now the parents ask you whether my child will improve or not. So what you will say? Every time it will be torturous to you, so we will move to the other side. Okay. Otherwise we can carry with you only. So tell me, how does the mother, how do you respond when a child, mother presents to you? I am not gender biased, of course. I will ask both male and females. So a mother comes to you and she has narrated you all the symptoms, and by using DSM and ICD you have made the diagnosis of autism. Now the mother asks you whether my child will improve or not. So what will be your answer? So the child won't come, the mother won't come to you again, thinking that this doctor didn't study anything. How can a disorder doesn't have any medications?
Fake hopes. I will give
You will give the fake hopes.
or carry that.
So in that scenarios, you need to know what is the course and prognosis of autism spectrum disorders. So these are the answers actually I expected. So normally, for any lay person, if you ask the prognosis and course of ASD, they will normally, you are very much right. They will say we can't do anything with autism spectrum disorders. Okay. So what can we do? So there is some non-pharmacological treatment and pharmacological treatment that I am going to tell you. But before that, whenever someone asks you the prognosis, that is dependent on multiple factors. Prognosis is not dependent on each only individual variable. Okay, it is dependent on multiple factors. You have to take care of all the things. For example, the parents are very much interested or parents are very much concerned about the child. So that gives us a prognostic, good prognostic factor for the child, because that will allow the child to learn more things. If the parents are very much well educated, that will again gives a good prognostic factor, because that will make the child to learn things at an early age. Okay, so prognosis is not completely what you say. We can't do anything with the child of autism, but it is dependent on multiple variables. In that's why you have to know what are the subdomains, what are the specifications, how do you classify autism. That is very important. So autism spectrum disorder is typically a lifelong disorder, as initially it was mentioned. It comes under pervasive developmental or neurodevelopmental disorders. So it starts at birth and almost it stays lifelong, with a highly variable severity and prognosis. So that should be the answer. It should be variable. The prognosis and the course is very much variable. Very good. They are discussing about our subject only, right? So what is the prognosis of autism? You can read the first slide. Just read the first slide. So, what is your answer? What is the prognosis of autism spectrum disorder? It is variable. The course and prognosis of autism spectrum disorder is very much variable. So, it is dependent on multiple factors, as I have mentioned. IQ. What is IQ? What is IQ? Intelligent quotient. Very good. What is SQ? So, you know what is IQ, that is intelligent quotient. What is SQ? Sometimes we use that also in autism spectrum disorders. What is SQ? Q is quotient again. What is S? Social. Social quotient. What is normal IQ? No. More than 70 you can broadly say, but what is normal IQ? There should be a range. It has been classified under dull, normal, borderline, mild, moderate, severe and profound, right? So what is normal IQ? You can say any number, 1 to 100 or 1 to 200, whichever number you can say, you can say. 80 to 70, 50 to 70. So he basically mentioned that above 70 is normal IQ. So you want, huh? No, I want what is normal IQ. So 90 to 110 is normal IQ. 90 to 110. So the children who are having less IQ, that is less than 70, with average adequate skills, I mean IQ more than 70 with good adaptive skills, who develop communicative languages by ages 5 to 7 years have the best prognosis. So the children who are having good intelligent quotient, the children who are having good adaptive skills, the children who are having early communicative development, so maybe the prognosis is very much good in these children. So a child presents to you having autism spectrum disorders but with very significant IQ. He is very intelligent, like the good doctor. Okay, so what is that syndrome called as? There is one syndrome where autism spectrum disorder children were presented to you with higher IQ. Savant Syndrome. Okay. So again, if you see good doctor, in one episode, they have mentioned what is Savant Syndrome also. So early intense behavioral interventions lead to recovery and function in the average rate. That is very important in case of prognosis. So what is Savant Syndrome? Emergency. Last time I was talking about something regarding to files and someone said, what is that file I asked? Then they said Epstein file. So we are talking about Savant Syndrome and you are saying something else. You can take a guess or you can take the help of your friends who have listened very nicely. You can take the help of your friend. You ask her. Still you are talking. I am talking to you. So what is Savant Syndrome? Even they haven't listened. That's why they don't know. No, she is saying something. Yes, please. So what is written as Savant Syndrome there? Huh? ADHD? PTSD? Achha. What is PTSD, by the way? You have seen in multiple movies, trauma, post-traumatic stress disorder. Very good. So the prognosis of autism spectrum disorder depends on multiple factors. One factor will be intelligent quotient. The other will be the early you treat the child, the more the good prognosis will be. So the behavioral treatment, if you start at the early age, the prognosis of the child is very good. Then ritualistic and repetitive behaviors do not seem to improve substantially over time. The prognosis improves if the home environment is supportive. As I have already mentioned, it depends on the parents, it depends on the support of the parents, it depends on how they treat the child, it depends on what is the burnout rate of the parents. So what is the treatment? There are two types of treatment always in psychiatry. So whenever you get any question, you have to write there are two treatments. One is pharmacological, the other one is non-pharmacological. Non-pharmacological includes psychosocial interventions. For example, if the child doesn't know how to make an eye contact, or if the child doesn't know how to talk with the parents, so the first intervention should be how to make them talk, or how to make them get an eye contact. Okay. So this is basically done in multiple sessions. We will make the child sit at one place for few minutes. Then we will ask the child to look at me, to look at into my eyes, so that he or she will get a reward. So this is basically a reinforcement method. Then social skills approaches, they don't know how to speak to other family members. They don't know how to talk to their parents. So this is one of social skills training will let the children know the social skills, how to talk with the parents, how to talk with the elderly age group, how to talk with the peers. And of course CBT and behavioral interventions for repetitive behaviors and associated symptoms. And you have, very important is you have to treat the comorbid symptoms. If an autism spectrum disorder presented to you, you have to treat the comorbid symptoms. It is not always a single diagnosis. You have to see what are the other differential diagnoses or what are the comorbid diagnoses the child is having. Maybe the child is having IQ impairment, maybe the child is having language impairment. So you have to treat them simultaneously. And educational interventions, in the school, how the child has to be educated, in the school, how the child should be placed, what are the instructions to be given to the child. These are the things that you should know. Then last, psychopharmacological interventions. For the core domains of social and communications, there are no interventions. But, I mean pharmacological intervention, but for some other symptoms, for example, self-destructive behavior, irritability, anger outbursts, maybe you will be having some few antipsychotics. So psychopharmacological interventions in ASD are mainly directed at associated behavioral symptoms when to the core domains. Target symptoms include, so in ASD, if the child presents to you with irritability, if the child is associated with aggression, temper tantrums, hyperactivity, inattention, again you can treat the child. So these are the some of the FDA approved drugs. For irritability, you can start risperidone 0.5 to 1 mg or 1.5 mg and aripiprazole from 5 to 15 mg. If the child is presented to you with ADHD, hyperactivity, impulsivity and inattention difficulties, you can start always the golden drug of choice, that is methylphenidate, atomoxetine and clonidine. RRSBI, that is restricted repetitive behavior, interest and activities, risperidone is again effective. There are some studies which states that SSRIs will be effective, but still there is no significant evidence, but on and off we can use SSRIs for restricted repetitive behavior, interest and activity.